So I will welcome everybody here for this kickoff meeting. My name is Nefi Paralampus Darten. I'm representing APIS. Actually, here we are. It's not just me. I don't know if you can see. It's everybody in the group that it's part of the organization team. And I will start talking a little bit about our organization. So the initials for APIS is Autism Praxis Infinity Solutions. We are a non-profit company. We are based in Limassol, Cyprus. And just a second, so I will minimize everything. So our purpose is promoting the rights and improving the quality of life of individuals on the autism spectrum, as well as their families. The team of professionals that staff the company APIS consists of volunteers specialized in autism with years of experience and activity both in Cyprus and abroad. And at the same time, APIS employs one person with autism part-time, and we also employ a second person by October 2023 with autism. I added our website if anybody wants to see our website. Our main services is training of professionals and therapists, consultation, training and guidance of parents, creation of provision of material, research and participation in European and other projects. And I'll talk about a little bit about the eHealth for autism, if it's that okay with Spiridon. Should I continue?
Probably let's hear the presentation of the Belgian Brain Council.
Yes.
Okay. Well, thank you very much for this kickoff meeting. And the Belgian Brain Council is a platform which gathers different associations, patient association, scientific societies, and some industry, all focused on brain diseases. Within the patient association, we have two focused on autism, and we are very keen to be associated with this partner, with this Erasmus Plus, because it was a good opportunity to increase the dissemination and also the education, because a key word is also education, and education should be at different level, different layers. And I think caregivers are very important to be also educated. And therefore, I think we are very keen to belong to this action. And we look forward for working together. So with us, there is also APEPA. APEPA is dealing with is a patient association, and the vice president Alice Luce is with us, and she will present what APEPA is doing. And also, I hope Michael Kissin from our university ULB, who is running a whole consortium dealing with the education of autism, will also present what is ACT. And Vinciane Quadback from EBC, she also worked on autism at the European level, and she will present what they have done at this level. I don't know if I see Alice online.
Yes, if we can hear a few words from Alice and Vinciane. Alice, would you like to start first?
Okay.
Can you share the slides of Alice, please?
I'm looking for my slide.
Because I cannot share. I don't think
you cannot share.
I will. No, I am not able to share. Maybe.
I think it's coming. Here
Yeah.
we are. Can you see it?
Yeah.
Okay. So first of all, I would like to thank the Belgian and European Brain Council for choosing autism as item for the Erasmus Plus project, with a special thanks to you, Mr. Roland Pochet, for inviting APEPA today on the kickoff meeting of eHealth4Autism. We really appreciate. So let me introduce myself, Alice Schulz, Vice President of APEPA, a non-profit organization for parents of autistic children and caregivers in Wallonia. Wallonia is the French-speaking region of Brussels. Do you see the slide?
Pleasure.
Can you share again, Alice?
Is it gone
Yes, please.
again?
Can you share again?
I can read. Vous êtes en train de partager votre écran. Nouveau partage. Can you see it now?
Yes.
Okay. Can you read Association de parents et de
Yes.
professionnels pour l'épanouissement des personnes autistes? So in English, it stands for Association of Parents and Professionals for the Fulfilling Development of Autistic People. We are all volunteers, like I heard just before. APEPA was founded in 1975, so we already have a long existence, by an ambassador, Salman, who was father of an autistic son. APEPA is dedicated to the entire autistic population and their families in French-speaking Belgium, called Wallonia, and also Brussels. The head office of APEPA is based in Namur, the capital of Wallonia. One of the members of the board of APEPA is an autistic Asperger lady, mother of 3 autistic children. So a good example of self-empowerment. The mission of APEPA is giving the support to the parents and adults with autism, and above all, defend their rights, the rights of ASD people on the spectrum. We do a lot of lobbying for autism at the politicians, the medical and educational decision makers. We organize trainings, conferences, roundtable discussions, workshops, participate in research with the universities of Brussels, Namur, Mons. We raise awareness among the public to increase the social inclusion. We're organizing events and communication on the social media and the web, for instance, on the 2nd of April, the World Autism Awareness Day. APEPA is under the high patronage of Her Majesty Queen Mathilde, that helps to open doors. Mathilde is a speech therapist and psychologist, our queen. Since during her studies, she worked with autistic children of our association. APEPA is recognized as representative of the autistic population in Wallonia by a ministerial decree of June the 7th in 2002. Autism is only recognized in the Walloon region as a disability since 2004. That means there is still a lot to do for autistic population. With an international prevalence of autism of minimum 1 in 100 people, it makes about 35,000 people with autism in Wallonia, plus 12,000 autists in Brussels region. About three quarters of them are adults, and most of them don't have a correct diagnosis or no diagnosis at all. So autism is not enough known by the professionals, we all know, the politicians and the public. The autism spectrum is very large and is only taught during a few hours at the university and graduate studies or higher education. The diagnosis of autism in adulthood presents additional challenges because almost all diagnostic instruments were initially developed for children, but in adulthood, it is sometimes difficult to obtain early development data. APEPA is also a member of AVIC, Agence pour une vie de qualité, Agency for a Good Quality of Life, management by the government of the Walloon region and Minister Christy Montréal. And at the committee disability branch, I hear talking a lot about people with reduced mobility and people in double diagnosis with mental, physical, and sensory problems. But in Wallonia, there is no approach, no support for half of the autistic adults. Higher functioning individuals are sometimes at a greater disadvantage because they might pass for neurotypical while trying to cope with severe anxiety, sensory dysfunction, and social and communication deficits. Our association, APEPA, is also co-founder of SUSA, Service Universitaire Spécialisé en Autisme at the University of Mons, created 30 years ago. So this was the first service receiving the autistic children and adults. First service in Wallonia for the diagnosis of toddlers, children, and other adolescents, and since last year also adults. We are also co-founder and member of Autism Europe. I guess you know Autism Europe. Autism Europe operates as an umbrella organization representing an estimated 5 million people through Europe. It brings together almost 90 member associations, individual members, and or self-advocates advocating for the rights of people with autism from 38 European countries and beyond, and to help them to improve their quality of life. Autism Europe also strives for more awareness of and understanding of autism in society. Mrs. Aurélie Baranger, Director of Autism Europe in Brussels, leads the negotiations for autism at the European Parliament. One of the themes is I can learn, I can work for youngers and adults, and also the all-around accessibility, promoting autism-friendly spaces and the access to medical services and devices as, for instance, e-health and welcoming face-to-face. An example here in Belgium, in the large hospital in Liège, a non-profit organization called Welcome facilitates the link between the autistic patient and the medical staff, the nurses and paramedical professionals. APEPA is also co-founder of Participate Autism. It's a website created on initiative of a sponsor with the collaboration of the 8 Belgian Centers for Diagnosis, about 3,000 pages, scientifically correct, and a file called Atlas, specially created for autistic adults. You can read the link to the site on the slide. And then we can read on the rear of the slide, APEPA gives information, support, awareness, training, lobby. That's the essence of what we do. But the World Autism Awareness Day, you all know, because we're all in charge of the autistic population. This year, on the 2nd of April 23, the statement of the United Nations organizations talked about advancing their rights. There's a lot to do still for the autistic population. Autism Europe on the 2nd of April called for promoting an inclusive society. It is still very important to talk about it and to aware the people. So every year, the Secretary General, Mr. Antonio Gutierrez, makes a statement in a topical item, topical theme. This year, they're also advancing their rights. And I talked about Autism Europe promoting an inclusive society at the European Parliament. And thanks to Erasmus+, Care for Autism, APEPA organizes during the month of April awareness-raising workshops on autism for adults and new technology. The target groups are mutual insurance companies, Forum, Public Service for Employment, AVIC, the agency of the Walloon region, EWITA, the Walloon Federation of Enterprises of Adapted Works, and also the city and province of Namur with the Handy Contact. And also parents and caregivers are always welcome to our workshops. Next slide. DSM-5, we all know them. The Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, dates from 2050, edited by the American Psychiatric Association. So the DSM-5 is a standard reference here in Belgium, I guess in your countries too, for the diagnosis of ASD, autism spectrum disorder. There are 3 levels of severity: requiring support, requiring substantial support, requiring very substantial support. And the severity is based on persistent deficits in social communication and interaction and restricted repetitive patterns of behavior. But severity is not always the biggest obstacle to personal happiness. Statistically, 25 to 30% of adults are non-verbal. So eHealth can be part of the solution if the layout of the documents is autism friendly and the content easy to read and to understand. We all know there are as many autisms as autistic people. They're all different. And we all know that a child with autism is an adult with autism. Then let's end with some good news and some highlights. ESCAP, I don't know if you know ESCAP. It is European Child and Adolescent Psychiatry. They edited a practical guide in 2020, so it is very recent, with a summary of evidence-based recommendations for diagnosis and treatment. Mental, physical, and sensory problems are also treated. In Belgium, we have a small organization, Otimating, which is developing teleworking for people with ASD. We, APEPA, we are busy with the project Constellations. Constellations is a project to create a digital platform based on artificial intelligence and big data to match the remarkable skills of people under the autism spectrum with job ads. The partners of the project are the University of Namur, Forum, the employment agency, AVIC of the Walloon region, and APEPA. But above all, there is Passwork. Passwork is a Flemish cooperative with a social goal. It puts autistic people on a digital job. So I read from the website. Passwork uses the qualities of people with an autism spectrum profile with a normal to highly gifted ability within various fields of expertise on the regular labor market. Our professional job coaching, and that's the point, the job coaching allows the unique talents of our employees to come into their own. So 13 years already, Passwork is operating. About 200 autistic people are working on a digital job. And I was told they are also co-developing eHealth in Belgium. So eHealth for Autism, from Erasmus Plus, is really part of the solution. Thank you very much for listening. And now I'm gonna listen to your presentation.
Thank you very much, Alice. I think we should rapidly move to another actor within the BBC, which is Michael Kissin, because he has to teach in a few minutes. So I suggest we give him the floor.
And if Alice could send us her presentation by email, it would be great.
I've sent it to Roland.
Yeah, I will. I will. Thank you. Thank you very much, Alice.
Thank you. You're welcome. It's my pleasure.
Michael.
Hi. Hi, everyone. I'm really sorry. It's because it has been really late notice. I have a meeting literally in 5 minutes because we're training our young researcher for presentations, and this has been scheduled for a long time. So I didn't. Roland notified me on Monday. I guess there are two developments that could be relevant to this project that took place recently in my lab. One is more fundamental research related, and the other one, Roland explicitly asked me to talk about it. It's a more societal project which aimed at collecting people's stakeholders' opinions about how Brussels House of Autism should look like. So first, just the first point I'd like to briefly mention, because I think it's an important development in the way research is implemented in Belgium and the way we should collaborate is this new project, our lab at the University Libre de Bruxelles, which is French-speaking, has with two other labs across the linguistic border. So you may know that we have two languages in Belgium, in KU Leuven and UGent. And what's the idea is we have these three labs across a multilingual landscape. And one of the main challenges I heard Alice talking about nonverbal individuals on the spectrum. One of the main challenges in autism is to understand what determines the linguistic trajectory of an autistic child. And basically at three, around 60%, 50 to 60% of children, autistic children, have very little or no speech. But by 7 years, some of them would gain a lot of language, some of them would gain some language, and some of them will remain nonverbal. And of course, language is one of the most important predictors of further outcomes and one of the main concerns of parents and caregivers. But as things stand today, actually, we don't know exactly what determines whether a kid will become verbal, whether they will remain nonverbal, or whether they will remain like they will have language with some limitations. And so in this big project, so it involves 9 academic researchers and 17 doctoral students and postdocs. We really want to collect as much data as possible from as many kids as possible during 3 years to understand what factors and may determine these language trajectories. And these factors range from sleep to social skills, to imitation, to mirror neuron systems. And so the way we do this is we design a really extensive protocol, a really comprehensive protocol, bringing in different expertise, but each lab will do exactly the same thing. And we also build, because it's really important to bring research to people who otherwise wouldn't come to the lab. And we designed 3 mobile labs. So these are vans where kids can come with their parents, and everything is in there. So we can really go to parents' places and to families which are from very different geographical and linguistic backgrounds. So this is really exciting, and this is what we'll be doing the next 3 years in collaboration with our Flemish colleagues. Another project, so Roland wanted me to mention you because it's really related to good practices. So the region of Brussels has its own government and its own financial budget, etc. And they want to create a house of autism. And but they didn't really know what shape this house of autism would have, neither physically, but also what kind of services they should provide, etc. And so they mandated us to try to find out. So the way we did it, we implemented a really like a 3-step study. So first of all, we implemented questionnaires to try to reach as many professionals, parents, caregivers, and autistic adults as possible. And then we conducted extensive qualitative interviews with stakeholders, so autistic people, families, professionals, but this time only the ones who live in Brussels. And that there was like, I think it was around 200 interviews, which were then transcribed. And then we organized focus groups and with politicians, different associations, different stakeholders. And then we put forward a proposal based on the needs people expressed, and also this, we proposed the structure which we think fits in the best with the way people we interviewed wanted this House of Autism to function. One thing that was really important, and I think this is the major methodological point, is that everything was open in live. So basically, at each step, we published everything we had. So you can find, actually, if you go to our website, you can find the final report, but you can also find a link to an open science framework repository where you have all the interviews, of course, for people who accepted that their interviews would be published, all the results of all the questionnaires, but also the comments of people who weren't really happy with the way we did things. And so in this way, we think politicians can make informed decisions, because these decisions are really made. They cannot ignore the voice of people we interviewed, because this is all there. So this was our condition to run studies like that. And we recently did another study for the same framework, and this was on the needs of disabled people in Brussels. And again, this report will be published soon. I think this is really the message that has to be sent to politicians when you ask researchers to propose solutions for them. This has to be entirely transparent and really open. So you can find all these on our website. I will put that in the chat here. And yeah, this is basically all the news I can tell you in this short time.
Thank you very much, Mikhail. It was very helpful. And thank you again for your flexibility, because I know you are very busy and you have to teach now. And it was, I think, very useful, and we will keep in touch, because I think we should take some lessons from what you have presented. Thank you.
Thank you very much. And I'm sorry, I have to leave, but if anyone has questions, you can find my email on this website, or you Google me and you'll find my email on the web. I'll be more than happy to contribute and continue this discussion. Good afternoon.
Thank you,
everyone.
Mike.
Thank you.
And now let's give the floor to our final speaker from Belgium, from the European Brain Council. It's a great pleasure to have Vinciane with us.
Yeah,
the European Brain Council is an associated partner in this project. We mention it in the project proposal, and we would like to thank you for this.
Yeah, I want to mention that there is another trainee which would like to present her logo, which is Amanta. This will be later, okay?
All right. Well, thank you very much for your invitation, Roland, Esperon, and the rest of the group. This is very nice being here and be able to present EBC and what we've been doing on the autism spectrum disorder, eHealth4Autism. I think it's key and part of the solution, definitely, as Alice said. Can you see my slides? So I was asked actually to present EBC shortly and what we have been doing for autism. So actually, the incidence and prevalence of brain disorders like autism spectrum disorder have increased over the past decades. And I'm here with sharing an article released yesterday in Politico, which highlight a key meeting on global partnership in brain research that the European Brain Council organized in March 16 during the Brain Awareness Week. And actually, it's very important to understand the increasing burden of brain disorders and also autistic spectrum disorder, because some of the biggest challenges facing brain health today is also not only to look at the increased burden, but also to define what brain health means to everyone. So the term brain health is wide-ranging from mental health, including anxiety, depression, and bipolar disorder, to neurodevelopmental disorders such as autism spectrum disorder and other neurological conditions. So therefore, it's really important to speak in one voice, and that's actually the role of the European Brain Council as a network of key players in the brain area with a membership consisting of scientific organizations, scientific societies, patient organizations, professionals, societies, and also industry partners. So yeah, here we are. We're also working closely with national brain councils such as the BBC and also with academic partners across Europe. So in terms of our core mission, quickly, yeah, of course, we're dealing with advocacy for brain health, converting data into policy recommendations through studies, facilitating innovation in the brain space with major meetings like the Brain Innovation Days, and towards actually looking at an integrated approach. So yeah, of course, the cost of non-action, and I think that's really important, and that's why I will explain what we did with the autistic spectrum disorder case study and the value of treatment. So looking at some economics is important. We also want to achieve in terms of the projects some more studies on the improvement of the access to treatment and care with a new focus on prevention, primary, secondary prevention, and also tertiary prevention, focusing on better health outcomes. We work actually closely not only with patients, we work with clinicians, with health economists, yes, looking also at together linking projects and policies, keeping the regulatory environment fit for purpose. Because in a way, it's important to look at what are the legislations in place, not only for health services, but also in more general terms at country level and also at the European level. So I was mentioning the value of treatment. This is actually a range of studies that we've been conducting over the past years and still continuing. As I said, looking at the increasing burden of disease, but also from a clinician perspective, from a patient perspective, but also from a health economics and outcomes research perspective. So this is mainly a health services research. We've been working with different academic partners across those studies, and here just quickly an overview of what we've been doing over the last years with 3 rounds of studies covering neurological diseases, rare neurological and neurometabolic disorders, and also mental disorders, among which autism spectrum disorder. So yes, in terms of actually results, I won't go into in-depth results because we will have publications coming out very soon now. As I said, I will mention and I will share those publications with Roland as soon as it's out in the European Psychiatry. But just to give the overall picture across the last 3 case studies that we conducted, anorexia, autism, and major depressive disorder, we saw that there are common challenges when we looked at the treatment gaps along the care pathway. So looking at prevention, screening, diagnosis, treatment, and follow-up along the patient pathway was actually an interesting steps to start. And then afterwards, we selected based on research questions what was actually going to be the economic modeling. But just briefly, what came out and necessitated further research was the lack or delay detection, the high waiting time and duration of untreated illness, including the access to expert centers, fragmentation of services offering the different treatment options, lack of collaboration between services, disruption in the continuity of care along the course of the disease and along lifespan as well, dropouts, and limited resources to share knowledge regarding the most efficient treatments. So in terms of the research and the scientific papers, there will be 3 papers coming out soon in the European Psychiatry. One paper on the cost consequences analysis of early intervention for autistic children that was conducted in 4 countries, Italy, Spain, UK, and Ireland. We did also a study on autism with co-occurring epilepsy care pathway in Europe, also covering those 4 countries. And then we did also a more extended research on autism care pathway in Europe. We also looked, but not from looking at autism as such, but we also looked at the impact of using health services, using digital tools on health services. And this is also another publication that will be coming out in the forthcoming months. In terms of the group, yeah, here a list of names active participation of partners across Europe, UK, Ireland, Spain, and Italy, and also other partners. So thank you very much, and I will share the publications as soon as we receive them.
Thank you very much for this useful presentation, and to the European Brain Council for being an associated partner in the eHealth4Autism project, which is a small project of 1 year. And now we have also Stella. I would like to
thank you very much. I want to thank Vinciane because it is very useful to have the support of the EBC. We have to learn a lot from the work they have done.
And let me introduce you an adolescent psychiatrist from Greece who lives in Denmark, Mrs. Stella Tathulopoulou. Would you like a
Hello.
brief, just so participants get to know you?
Yes, thank you very much. And I wanted to say thank you for the invitation to participate in this group. I'm very honored. I am a specialist adult psychiatrist, and I have experience working in Scandinavia, in Denmark and in Sweden for the last 10 years. I have been working with both adults, children and teenagers with ADHD and autism. So I have been trained to both diagnosis and treatment of these conditions. And I must say that especially in adults, it is quite challenging, both in a diagnostical perspective, but also in matters of awareness between colleagues. So more education in this field is needed, and my purpose is to be able to combine knowledge from different countries. Right at the moment, I'm working with this transfer between Denmark and Greece, and I'm doing this by developing my own special adult neurodevelopmental clinic in Greece, and attending to conferences, courses, and exchange of knowledge between the two countries. I'm very, very happy for this project, and I hope that we can all contribute to the best for the autistic people.
Thank you very much. And let's give the floor to Fokion Dimitriadis from Epioni, who is the Secretary General of Epioni, to make a presentation of Epioni. And then we will continue with the presentation of the project.
Hi, everyone. Hi, everyone. My name is Fokion Dimitriadis. I'm General Secretary in Epioni, and I will present the partner Epioni, Greek Carers Network Epioni, in the context of the kickoff meeting of eHealth4Autism. I will share my screen. The presentation will be brief. So, Greek Carers Network Epioni is a non-profit, non-governmental, national Greek organization established in 2016 in Athens for the support of informal family carers, who are individuals who provide unpaid informal care to relatives or friends with a chronic physical or mental illness, disability, or addiction. Our goals are three. First, supporting informal carers in Greece, irrespective of their age or the particular health need of the person they are caring for. Documenting and raising awareness about the significant contribution made by carers to the Greek health and social care system. And advocating for national policies that take account of carers. That is, they promote their social inclusion, the development of support services, and enable them to remain active in paid employment and maintain a social life. Our mission has 4 parts. First, to help establish the institution of informal carers in Greece. Second, to contribute to the recognition by the state authorities of the existence of informal carers across Greece, currently numbering over 3 million. Third, to contribute to the establishing of informal carers' rights to flexible working arrangements, paid or unpaid leave, and other entitlements. And fourth, and last but not least, to educate the public and other relevant stakeholders to support informal carers. In order to realize our goals, we conduct various activities, such as organizing events where we educate and inform audiences about the issues concerning informal carers. We lobby public officials to support informal carers, and also we participate in EU projects such as eHealth4Autism, where we work together with other organizations for the exchange of good practices or the production of intellectual output in the field of mental health. We have established partnerships at the national and European level. At the European level, we are a member of various organizations, most importantly, Eurocarers, which is the European Federation of Carer Organizations, European Caregiver Organizations, and we have modeled our pattern of development after Eurocarers. We are also members of Mental Health Europe, the European Association of Service Providers, and EUFAMI, the European Federation of Associations of Families of People with Mental Illness. Some projects, Erasmus Plus projects, were approved for 2023. I will mention eHealth4Cancer, which is exchanging good practices for the non-clinical eHealth solutions for cancer patients and their caregivers in Europe. And our relevant experience, relevant to eHealth4Autism is a project called Care4Autism that is running currently and is sharing good practices for adults with autism and their family carers. Also, because ADHD is also a neurodevelopmental disorder, we have experience in running ADHD-EU project that is currently running, Erasmus Plus project that was approved last year. We celebrate Informal Carers Day every 6th of October by organizing an event and holding an awareness event on that date every year. We also hold events with support of the Office of the European Parliament in Greece. Next event will be in June and October 2023. We are active on social media, Twitter, Facebook, Instagram, LinkedIn, and YouTube. Thank you for your attention.
So for the specific project, the eHealth4Autism, as you know, we're going to be the coordinators. The title, the whole title is sharing good practices for the use of non-clinical eHealth solutions for adults with autism and their caregivers in Europe. Duration is 13 months. Supposedly started in February 1st and is going to end in March 1st to 2024. The total budget is 30,000 euros. The language that we're going to mainly use is English. Proposed activity is good practices guide, and that will be uploaded in ABI's website and as a separate page for that. We already, I think we already have this settled, and we're gonna send it to you in the next week. as far as the steps we are following and anything anybody wants to share on that page. The target group is adults living with autism, educators working with adults with autism in Belgium, Greece, and Cyprus, informal carers, families of adults with autism, healthcare professionals and researchers working with adults with autism and directly and indirectly, and citizens in Europe in general. I divided the, I put here the table that was already in the booklet that I don't know if you guys have it, and those are the activities and the titles we have to go through. And awareness events that there are two. One was April 2nd, and the next one is the European Carers Day. So you can, I guess we can choose which one. It's for one day. You all have the budget. That's a 3,000, and I guess for each organization has a different amount there. The good practices.
It's 500 euros per partner per event. So Belgian Brain Council has 500 euros for the April event and 500 euros for the October event.
Okay. All right. So okay, so good. All right. I don't know. So good practices, guy. I mean, I highlighted what is for us. Sorry, I don't know about the rest of the people. We something that I forgot to say is that we transfer the 80% of each organization. So when you guys receive the amount, please let us know in order for us to be sure that you have it. So the second activity is the good practices guide for non-clinical e-health solutions for adults with autism and their caregivers. And that's for the whole years. And that's the guide that I'm guessing we got finally upload on the page as the final result. Learning activity, which is going to be in Cyprus. On the next slide, I break down the dates and how we can possible work on that. It's going to be a workshop, a study visit at the university, a project meeting in Limassol and in Nicosia. And I wasn't for sure. We have 2 days. Actually, it's 2 days. That learning activity. I just put 4 days because I included the day you are arriving and the day you are leaving. So I just put 4 days. Project management and implementation for the coordinator and the partners. And that's also for the whole year and extra, I'm guessing, for the 2 extra months that we're going to finalize it and send everything to the national agents. So what we have to decide is as far as meetings and then teleconferences. Meeting in Cyprus will be in November between 20 and 24th. Teleconference. Teleconferences. We already had a short teleconference in the 14th of April, 2023. So we need to decide as far as for the months of June, August, and January 2024. What are the best dates for each of us, so we don't have to send each time a message and deciding earlier, because it's a full year of activities for everybody, I'm guessing. And the final meeting, which that's something that it's negotiable if we're going to decide to do it, and it's something that we can talk later if we're going to do it or not, or if we have actually the budget for anybody to travel, be there. As far as the meeting in Cyprus, we sent some dates for the traveling, and that's arriving to Larnaca November 20th. So meeting dates will be 21st and 22nd, and that will be the 2 days we have on the table that I showed you before. The visit at the European University will be on the 23rd, and that's because departure is from Larnaca is 24th. It's shorter traveling from Nicosia to Larnaca. And we arrange a tour there at the university and a presentation from a representative of the Department of Education and Assistive Technology. And we're expecting somebody to, we're expecting a name now. So as far as Cyprus wise, that's what it's gonna be. So the events that we all have to have, each country has to organize the event. It was one on April 2nd, 2023, and or the October 6th, which is for the Carers International Day, as far as I understood, 2023, and that's up to each country. The last one, it should be January, which I don't know. I think we should wait for that.
Yeah, we should wait.
Yeah.